Good morning, everyone. Welcome to today's presentation. I'm excited to be here with you. Today, we will be discussing moving, lifting, and transferring patients. This is part of our nursing foundation for BSc Nursing, first year. Over the next few minutes, we'll explore the essential techniques and safety tips to ensure patient and caregiver safety during these important activities. Let's get started. Welcome to today's discussion on safe moving, lifting, and transferring of patients. These are fundamental nursing skills that we use every day. It's crucial to understand that doing these tasks properly can make a big difference in preventing injuries. When we apply the correct techniques, we not only protect ourselves as caregivers, but also ensure the safety and comfort of the patients. Remember, safety is always a top priority in patient care, and mastering these skills is essential for providing high-quality, safe nursing practice. Today, we'll focus on the key objectives of this session. First, we'll define what moving, lifting, and transferring mean in the context of nursing care. It's important to understand these terms clearly because they form the foundation of safe patient handling. Next, we'll review the core principles that guide us in handling patients safely. These principles help protect both the patient and ourselves from injury. We'll also look at the different types of equipment used to assist with moving and transferring patients. Equipment plays a crucial role in making these tasks safer and more manageable, especially with patients who have limited mobility. Finally, I'll demonstrate some correct techniques for moving and transferring patients. Proper methods are essential to prevent injuries, and I'll show you how to do these safely and effectively. Throughout this presentation, keep in mind that our goal is to promote safety, comfort, and dignity for our patients, while also protecting ourselves from injury. These objectives tie directly into our overall theme of providing safe, compassionate, and professional care. When it comes to safe moving and lifting, there are some key principles we should always keep in mind. First, maintaining a wide base of support is crucial. This means keeping your feet shoulder-width apart to ensure stability and balance throughout the movement. Next, remember to bend your knees, not your back. Bending at the hips and knees helps protect your spine and reduces the risk of injury. Another important point is to keep the patient close to your body. Holding them close minimizes strain on your muscles and makes lifting or moving easier and safer. Avoid twisting your body while lifting, as this can put undue stress on your back and lead to injury. Instead, turn your whole body by pivoting your feet if you need to change direction. Using your strongest muscle groups, like your legs and hips, is essential for lifting. This helps distribute the effort and keeps your back safe. And of course, don't hesitate to ask for assistance when needed. Lifting or moving heavy or awkward loads alone can be dangerous, so teamwork is always the best approach. These principles tie into the overall theme of ensuring safety for both the patient and ourselves, by using proper techniques and being mindful of our body mechanics. Today, I want to talk about the equipment we use to ensure safe and effective patient transfers. First, we have the wheelchair, which is essential for mobility and comfort when moving patients who can't walk on their own. Next is the stretcher, typically used for patients who need to lie flat or require more support during transport. We also rely on mechanical lifts or hoists, which are crucial for safely transferring patients who are very heavy or have limited strength, reducing the risk of injury for both the patient and the caregiver. Then, there's the slide board or draw sheet, which helps facilitate smooth transfers, especially when moving patients between surfaces like a bed and a wheelchair. The gait belt or transfer belt is another vital piece. It provides a secure grip and helps us support the patient's stability during transfers. All of these tools are interconnected and vital to our overall goal of providing safe, dignified, and efficient transfers. By understanding and properly using this equipment, we can improve patient safety and comfort while reducing the risk of injury for everyone involved. Let's talk about some key techniques for safe patient handling and mobility. First, moving a patient up in bed with a draw sheet is an essential skill. It allows us to reposition the patient smoothly without causing discomfort or injury. Next, turning a patient to a side-lying position helps with comfort, pressure relief, and even toileting or hygiene care. When transferring from the bed to a wheelchair, proper techniques are vital to ensure safety for both the patient and the caregiver. It's all about using the right body mechanics and equipment to prevent strain. Assisting with ambulation is another critical skill, whether the patient needs help walking with or without assistive devices like canes or walkers. Supporting their mobility promotes independence and improves their confidence. Finally, for patients who are dependent and can't assist with movement, mechanical lifts are a valuable tool. They reduce the risk of injury and make transfers safer and more comfortable. Overall, mastering these techniques is fundamental to providing compassionate, safe, and effective care. Let's talk about some key safety measures to keep in mind during patient transfers. First, it's essential to lock the wheels of both the bed and the wheelchair before you attempt to move the patient. This simple step helps prevent any unintended movement and keeps everyone safe. Next, always check for dizziness before you help the patient stand. If they feel unsteady, it's better to wait or find additional support to avoid falls. Proper footwear and clothing are also crucial. Make sure the patient is wearing non-slip shoes and comfortable, appropriate clothing to prevent accidents. It's equally important to provide privacy and explain what you're about to do. Patients feel more comfortable and secure when they understand the procedure. And finally, always use correct posture and coordinate with your team. Good body mechanics protect you from injury and make the transfer smoother. These safety measures are vital because they protect both the patient and the caregiver, aligning with our overall goal of safe and effective patient care. Let's take a moment to talk about some of the serious complications that can arise from improper handling. First, there's the risk of back injury or strain in nurses. When proper techniques aren't followed, it can put a lot of unnecessary stress on the back, leading to long-term injuries. Next, improper handling can also lead to falls or fractures in patients. If patients are not moved carefully or securely, they might fall and sustain fractures, which clearly impacts their recovery and safety. Additionally, muscle fatigue or sprains are common if handling isn't performed correctly. Repeatedly lifting or maneuvering patients without proper technique can tire out muscles and cause strains. And finally, there's the broader impact of losing patient confidence and feeling of safety. When patients sense that their care isn't handled properly, it can undermine their trust and make them feel less secure during their recovery. All of these points highlight the importance of proper handling techniques, not just for the safety of staff, but for the overall well-being and trust of our patients. It's a key part of providing quality, safe care. Let's talk about the importance of documentation during transfers. First, it's crucial to record the type of transfer performed. This helps ensure accuracy and continuity of care. Next, make sure to note any assistance or equipment used. This provides a clear picture of what was involved. It's also vital to document the patient's response and how well they tolerated the transfer, as this can inform future care decisions. And finally, always report any unusual occurrences immediately. Addressing these promptly helps maintain safety and quality in patient care. Remember, thorough documentation is key to providing safe, effective, and coordinated care throughout the transfer process. Let's wrap up with a quick summary. Safe patient handling is really a win-win. It protects both the patient and the nurse. Remember, using the correct techniques is essential, but teamwork and the right assistive devices also play a crucial role in making transfers safer and easier. Always keep safety and comfort at the forefront during every transfer. Prioritizing these aspects helps prevent injuries and ensures a better experience for everyone involved. Thank you for your attention throughout this presentation. Now, I'd like to briefly touch on the references that supported our discussion. First, we have Potter and Perry's Fundamentals of Nursing, 10th edition, which provides a solid foundation in nursing principles and practices. Then, Cozier and Erb's Fundamentals of Nursing, 9th edition, offers comprehensive insights into nursing care and patient safety. We also referred to the Indian Nursing Council's Nursing Foundation syllabus, which guides the standards and curriculum for nursing education in our country. Lastly, the WHO Guidelines on Safe Patient Handling from 2021 serve as an important international resource emphasizing safe practices for patient and healthcare worker safety. These references underscore the importance of evidence-based practices and continuous learning in nursing. They connect directly to our overall theme of safe, effective, and compassionate patient care,